I get a lot of messages and emails that ask me, how did I survive my first 6 months, my first 12 months as a nurse practitioner? Hi guys, welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and in today's video, I'm going to kind of give you guys a little bit of survival tips that's going to help you transition from a nurse to a nurse practitioner. These are going to help you with those first 6 months, those first 12 months, even your first 2 years as a nurse practitioner, because I have been actually practicing now for almost 2 years. October 1st would be 2 solid years. If you have not yet subscribed to the channel, go ahead and hit that subscribe button and also click the notification bell so you are notified every time I upload a video. The first tip that I will give to you is that you need some good resources once you are in the role as a nurse practitioner. And this is why I am going to tell you this, because as a new nurse practitioner, there is no precepting going on. When you graduate from nursing school and you get that first job, it doesn't matter where you get that first job, you are kind of put with a nurse who's probably been on that unit for a while, or even if you go to an outpatient setting and work, you're kind of put with a nurse to kind of precept you for the first couple of months or couple of weeks or whatever it is to get you acclimated to that role. When I got my job, I got some precepting from my boss for wound care, and that's because I didn't have any wound care experience, so he precepted me for wound care. Everything else, no ma'am, you are on your own, because these physicians that are going to hire you, they are going to be assuming, well, you're a nurse practitioner, you know what to do. So if you are a nurse practitioner and you were precepted, kudos to you, and let me know in the comments if that is the case, because most of the time there's no precepting going on. So you definitely need to get your hands on some good resources, because when you were a student and you had the physician that you're working with or the nurse practitioner that you're working with that you can ask questions and bounce ideas from, you're not going to have that so readily. If you do have a collaborating physician who is amazing and awesome, and you can text them and call them and ask them any single question, that is also amazing. But 9 times out of 10, you ain't about to have that, and you don't want to call them at every single time to ask every single question. So good books, good apps. And I'm actually working on another video where I share with you guys some apps that I use, books that I use all the time that help me. And these resources are definitely going to guide you in making good and sound and safe decisions for your patients. Because if your patient comes in and they're complaining about something and you don't really know what angle you want to go with it, you can look things up really quickly just to see what kind of tests and what kind of diagnostics you need to order and what you need to start putting into place to help this patient. Because I'm going to tell you now, patients are going to come in and they're going to be like, what's that? I've been doing that for 2 weeks. Can you tell me what that is? Like, craziness. I know you're going to get it. You are the provider, so they're going to be looking at you to give them answers, you to give them suggestions. The second tip that I will definitely give you is that it doesn't matter where you work. I will definitely suggest that you go ahead and you write down some of the most common things that you see coming into your office, most common complaints that you see coming into your office. When I was in my pediatric clinicals, the pediatrician that I was working with, she was the one that said to me, even though I wasn't going to go into peds, she said to me, to make it easier for me, write down the most common diagnoses for kids that come in and what are symptoms that fall under these categories. And I did the same thing for my outpatient experience. What are some of the things that I was seeing all the time that was coming into the office, and what are some of the symptoms that the patients had? Because a lot of times patient A is complaining of one symptom, patient B is complaining of one symptom, but the diagnosis is the same. Every patient sometimes doesn't have the same symptoms. So if you kind of compile that and you put each what they could complain about under that diagnosis and what kind of testing you would order for that and what you would start to treat the patient with, it is going to make your life a whole lot easier, and it's going to make you go faster with your patients, because as a new nurse practitioner, you are going to be slow. And when I say slow, I mean a snail's pace slow. When I started working, I remember my boss saying to me, Lori, I want you to see 15 to 18 patients a day. And in my mind, I was like, oh, that ain't nothing. That's fine. That's doable. 15 to 18 patients as a new nurse practitioner is a lot of patients, because you are just getting your feet wet and you are trying to come do your progress note, you're trying to do your diagnoses, your treatment plan, following up on different things. So that is kind of a lot of patience. But once you have these things in place, it's going to help you go a little bit faster, and it's going to be a no-brainer for you. I am also going to tell you this: with experience comes comfort. And once you get more experience as a nurse practitioner and you are seeing these things over and over and over again, this is repetitive. It is absolutely repetitive. You see this thing all the time. You know what to do just like that. And the more you see it, the more it's going to roll off of your tongue for what you need to tell the nurses to do. And you're going to be like, oh, I need to order this, I need to order that, and this is what this is. And you're going to go about your day. The next tip that I will give to you is that you really need to know your guidelines. If you know your guidelines and you're treating your patients based on these guidelines, you will be okay. I know I made a video, I think I did my 1 year later video. If you've not seen that, I'll put it up. But in my 1 year video, I remember saying I was so nervous to do anything even though I knew guidelines, and that was just my imposter syndrome rearing its ugly head. But if you know guidelines, you will be okay. So if you are working in the primary care office, you need to know when to order colonoscopy test for your patients. You need to know when your patient should have their screening for their eye exam, different things like that. If your patient is diabetic, you need to know what are the guidelines for these blood pressure meds. Which blood pressure med should I use to treat a patient if the patient has like renal failure? Which one is better? So once you have these things kind of down pack, and I remember I had these things written down, like guidelines for blood pressure med, which one is best for this. And because I am in the nursing home setting, what I also did was, when it came on to antibiotics, because antibiotics for me was very challenging, and in a nursing home setting, patients get two infections: UTI and community acquired pneumonia. Basically is what type of infection they tend to get. So I remember I was making a list and making a chart of what antibiotics is better for each and what's the gold standard for each, as well as if the patient is allergic to this class, what should I use next? So if you have those things kind of written down somewhere, and the more you order it, the more you do it, the more you will get it. And I'm telling you, like I said, it's going to come as if it's repetitive, and you'll be definitely okay at the end of the day. I do hope that these survival tips will help you on your journey in the nurse practitioner role. And I will also say, guys, I am working on videos about lab values, because I get several emails also about interpreting lab values. So I'll definitely make videos about that. They're coming. Trust me, they are coming. Thank you guys for watching. Don't forget to like, comment, and subscribe, and I'll catch you guys up on my next video. Bye, guys.